We are digging into a treatment for mental health that has recently been put in the spotlight for the dangers it can pose. We're talking about ketamine therapy. Earlier this month, 5 people were charged in the high-profile death of actor Matthew Perry, who died last October in his hot tub in Los Angeles. An autopsy revealed he died from the acute effects of ketamine. Perry had been receiving regular ketamine infusion treatments for depression. Ketamine has seen a huge surge in use in recent years as a treatment for depression, anxiety, and pain, but it can be addictive, which is why it needs to be administered in very specific ways. DENT Neurologic Institute is one facility here in Western New York that provides this therapy. 7 News reporter Krista Moran is learning more about this treatment from a doctor at DENT and shares the voice of a woman who relies on the therapy.
Within DENT's Interventional Psychiatry, there's hope when it comes to battling mental health.
It is possible to get out of a deep depression.
Elizabeth shared with me that she's been battling depression her entire life.
I've tried so many different other options and nothing had really worked.
That's until she tried ketamine infusions at DENT.
It's like turning on a light. It really is. There was a point where because of insurance, I had to skip about 4 weeks or so, and that put me back into a deep depression. So it's literally is life-changing.
The cool thing about it, though, is it works almost immediately. So patients that respond positively to ketamine, there's a 50-50 shot that the day they receive treatment, their depression will improve. There's no other treatments available that work that quickly.
Mike Asback is a psych PA and the associate director of the Interventional Psychiatry. He says this treatment is helpful, especially for people who experience a resistance to antidepressants.
And those meds have helped a lot of people, but they also fall short. There's a lot of people that don't respond to those meds. So it's an exciting time to be in mental health because we finally, after 50 years, are having real significant innovation and breakthrough in how we can treat these patients.
Ketamine is a dissociative anesthetic. Patients can either undergo an IV infusion or use nasal spray, and it's all done in a safe and supervised way.
Because certainly this is a treatment that can be quite safe when done correctly, but as we've seen with recent news, when done incorrectly, it can have some potential risks and concerns and certainly abuse potential. So we talk through all of that with the patient. But at the same time, we want to make sure that things like the Matthew Perry incident don't lead to patients maybe not considering it as a treatment option, because it still can have an immense potential benefit for patients that are suffering.
And for Elizabeth, this treatment that she's been receiving since 2018 has helped her make progress in battling her depression.
It's amazing.
And if you or someone you know is struggling, help is available. You can call or text 988. Krista Moran, 7 News, Amherst.